What is bipolar disorder? Bipolar or manic depressive disorder is a frequent, severe, mostly recurrent mood disorder associated with great morbidity. The lifetime prevalence of bipolar disorder is 1 to 3 to 1 to 6%. The mortality rate of the disease is 2 to 3 times higher than that of the general population. About 10 to 20% of individuals with bipolar disorder take their own life, and nearly one-third of patients admit to at least one suicide attempt. The clinical manifestations of the disease are exceptionally diverse. They range from mild hypomania or mild depression to severe forms of mania or depression accompanied by profound psychosis. Bipolar disorder is equally prevalent across sexes, with the exception of rapid cycling, a severe and difficult to treat variant of the disorder, which arises mostly in women. Because of the high risk of recurrence and suicide, long-term prolific pharmacologist treatment is indicated. Lithium salts are the first choice long-term prevention treatment for bipolar disorder. They also possess well-documented anti-suicidal effects. There are 3 types of bipolar disease. All 3 types involve clear changes in mood, energy, and activity levels. These include bipolar disorder 1, bipolar disorder 2, and clinoclonic disorder.
Effects on bipolar disorder. Bipolar disorder, formerly called manic depression, is a mental health condition that causes extreme mood swings that include emotional heights, mania or hypomania, and low depression. When you become depressed, you may feel sad or hopeless and lose interest on pleasure in most activities. Bipolar disorder can cause your mood to swing from an extreme high to an extreme low. Manic symptoms can include increased energy, excitement, impulsive behavior, and agitation. Depressive symptoms can include lack of energy, feeling worthless, low self-esteem, and suicidal thoughts. Long period of feeling hopeless or helpless or having low self-esteem. A decreased amount of energy, an inability to concentrate or to make simple decisions. Changes in detailed habits such as eating and sleeping patterns.
Diagnosis. A diagnosis of bipolar disorder 1 involves either one or more manic episodes or mixed manic and depressive episodes. It may also include a major depressive episode, but it may not. A diagnosis of bipolar 2 involves one or more major depressive episodes and at least one episode of hypomania. To be diagnosed with a manic episode, you must experience symptoms that last for at least 1 week or that may cause you to be hospitalized. You must experience symptoms almost all day, every day during this time. Major depressive episodes, on the other hand, must last for at least 2 weeks. Bipolar disorder can be difficult to diagnose because mood swings can vary. It's even harder to diagnose in children and adolescents. This age group often has greater changes in mood, behavior, and energy levels. Bipolar disorder often gets worse if it's left untreated. Episodes may happen more often or become more extreme, but if you retrieve treatment for your bipolar disorder, it's possible for you to lead a healthy and productive life. Therefore, diagnosis is very important. What part of the brain does this affect? Participants with bipolar disorder exhibit thinner corneal gray matter form in frontal, temporal, and parietal regions of both brain hemispheres. Bipolar disorder had the largest effect on the left pars oculis, left perfusion gyrus, and left rotatorial middle frontal cortex. The results suggest that frontal gray matter loss in bipolar disorder can be attributed to the occurrence of mania. It is a long-time structural MRI study of bipolar disorder. ABL revealed a reduction in volume of frontal cortex in patients who experience manic episodes, but not in those who remain well.
Who does it usually affect? The average age of onset is about 25, but it can occur in teens or more uncommonly in childhood. The conditions affect men and women equally, with about 2.8% of the United States population diagnosed with bipolar disorder and nearly 83% of cases classified as severe. Here are some criteria on bipolar disorder. Bipolar disorder is a mental health condition that's known for its period of both mania and depression. The diagnosis for bipolar disorder requires at least one depressive and one manic or hypomanic episode. Your mental health specialist will ask you about your thoughts and feelings during and after these episodes. To be diagnosed with bipolar disorder, a person must have experienced at least one episode of mania or hypomania. To be considered mania, the elevated, expansive, or irritable mood must last for at least 1 week and be presented most of the day, nearly every day.
Mental health awareness.
Oh, hey, doctor, I'm here to be diagnosed.
Take a seat, relax, be calm, and open up your mind.
Later.
Why did she do this to me?
Here, take this for comfort.
Later.
I hate you. I hate you. Take it back. Why did she do this to me?
More moments later.
Fine. Take this stuff you threw on me.
Where am I? Who are you? Who are you? Where am I?
More moments later.
By my calculations, you have bipolar.
Wow, thank you so much, doctor. I am feeling so good now. Quack, 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 quack. Thank you so much, doctors.